Hello and welcome to Tufts Graduate School of Arts and Sciences Graduate Student Speaker Series, or GS4. This is our third GS4 speaker series, and we are so pleased to have Alexandra Duprey here today. Alexandra is from the Department of Urban and Environmental Policy and Planning. We want to give her time for her presentation, and then we'll allow a few minutes at the end for questions. Alexandra, I'll turn it over to you.
Great, thank you so much. So like she said, my name is Alexandra. I have done some research on the issues of equity and resilience within the COVID-19 crisis. And I'm going to talk to you a bit today about what I've found. So first and foremost, I think it's important to contextualize this presentation within the current crises of our time. And so that includes both the crisis of the COVID-19 pandemic and then the crisis also of systemic racism and historic injustices committed against Black, Indigenous, and people of color communities. I think it's important for us to keep in mind that marginalization is not a natural phenomena and that it is intentionally inflicted upon stigmatized groups by those that hold power and privilege. In discussing resiliency as our country recovers from these crises, understanding this context is foundational. And this acknowledgement in and of itself will actually come for full circle into the work I've done. And it's really integral to some of the recommendations I make. So the COVID crisis has been framed by the governor of New York as the great equalizer. But in fact, it's actually shown to be the great revealer in a lot of ways. So at the beginning of the spread of infections in the US, it seemed to be affecting everyone, but over time, officials like Representative Ayanna Pressley have called for better demographic data on COVID. And it has become increasingly apparent that the pandemic is hitting Black and Latinx communities harder than others. For example, the city of Chicago is only 30% Black, yet Black Americans account for over 70% of all COVID cases in the whole state. One of the worst rates of infection in Massachusetts are right around the corner from us in the largely immigrant community of Chelsea. As communities discuss how to prevent something like this in the future, the issue of resiliency is at the forefront of conversation, primarily with the goal to reduce exposure, risk, and future vulnerabilities. But looking at these issues through the lens of urban planning can better provide significant insight into how these disturbing disparities occurred in the first place. So the agenda for this presentation is I'll explain a bit about the research trajectory. I will briefly explain the field of urban planning and how it interacts with the concept of resilience. I will exemplify how the concept of resilience plays a role in marginalization and vulnerabilities. And then finally, I will suggest a framework for recovery efforts for a post-COVID city. So first, a little bit about my research. I've been working with Professor Julian Ageman of the Urban and Environmental Policy and Planning Department at Tufts. The research initially started as exploring intersections between Julian's work on just sustainabilities and then my interest in resiliency. So just sustainabilities refers to the need to ensure a better quality of life for all now and into the future in a just and equitable manner. While also living within the limits of supporting ecosystems. So at the beginning, this work was looking at resiliency to climate change. I was looking at planning documents and resiliency plans issued by various cities and looking at how they adjust equity and justice. I also did a literature review of the field of resiliency. However, when the COVID pandemic took hold of the world, that was at the forefront of all of our minds, and we changed the focus of the research to equity issues surrounding the pandemic. And then moving forward, the previous explorations we made of resilience actually greatly informed like a way of approaching how cities and urban areas can recover from the pandemic. So for those that maybe don't have a background in urban planning, just to summarize a little bit, it's a technical and political process that molds development within a city. Planning designs how land is used and how the built environment will grow. And urban planners influence issues like housing, transportation, parks, infrastructure, and access to various services like libraries or hospitals. And the major urban planning organization, the American Planning Association, really advocates for equity in the field. And a lot of that is because of some of the history of urban planning, which I'll talk about in a bit. So the issue of resiliency is becoming more of a hot topic in the field. It's essentially the capacity to recover quickly from difficulties. This term has long been used for like psychological development and barriers surrounding that, but now it's being widely applied to systems like cities. So the 100 Resilient Cities Project defined urban resilience as the capacity of individuals, communities, institutions, and systems within a city to survive, adapt, and grow no matter the stressors or the shocks that they experience. And I included this castle image because in a way it's seen as fortification. It's seen as strengthening and preparing systems for these shocks. However, the capacity of an area to manage risk and to adapt in the face of stressors is often unevenly distributed. Even within a whole city, different communities can have different capacities. So in talking about urban planning and resiliency, we have to talk about some of the historic inequalities that have been perpetuated by urban planning. For centuries, urban planning and city management at large has inflicted a painful history of segregation and harm on Black communities. This has been done through systemic discrimination, and communities of color were excluded from things like home ownership and wealth building opportunities. This denied them access to educational resources and dignified jobs in healthy neighborhoods. And it perpetuated segregation, displacement, harmful stereotypes that were committed through zoning, deeds and covenants, lending practices from banks, and then such issues as public housing and urban renewal. So an example of this, to kind of ground it a bit, is the process of redlining. Redlining is the systematic denial of various services by government agencies or possibly through the private sector. So neighborhoods that had a high proportion of minority residents have been historically more likely to be redlined than other neighborhoods with similar household incomes. This term was originally coined by a sociologist, John McKnight, to describe the discriminatory practices of different areas where banks would avoid investments based on the community demographics, such as Black inner city neighborhoods. In Atlanta, an investigative journalist working in the 80s, so it's been a long time, found that banks would often lend to lower income white people, but not middle income or upper income Black people. While redlining often involves denial of financial services, other services like healthcare or even grocery stores have also been shown to be denied. And it wasn't until the 1960s when the Civil Rights Movement led to various like Fair Housing Act and Community Reinvestment Act that this really began to change. Yeah, so this kind of goes into like some of the different issues surrounding it. And yeah, it basically covers it. And so vulnerability, as a result of these discriminatory practices in urban planning, communities of color were not able to accumulate the generational wealth that white families were. And these communities were forced to areas of the city with greater environmental hazards, which I tried to show in this picture. And this is part of the issue with environmental injustice and the future of climate change repercussions. And then these areas are also prone to have less adequate services like poorer hospitals, schools, unreliable transportation, and less adequate grocery stores. So now that we understand the implications of historical spatial marginalization in these communities, it's easier to understand how these communities are more prone to pre-existing conditions. They have more low-income employment opportunities and less access to essential services. So keeping these things in mind, this history situates the prevalence of the COVID-19 infection and reveals a disproportionate risk historically purposefully put on these communities. And this is extremely relevant also for the place that we live in. The nearby city of Chelsea has long been a place for immigrants coming to the US, and most of its current population is Latinx. Many are low income and speak other languages before English. And it's no coincidence that this area also hosts a bulk of industrial facilities and hazardous sites. And this area also has the highest rate of COVID-19 cases in Massachusetts. So these issues are very real, and they're happening like right around the corner from us. And so how can our cities do better? My work looking at how equity and justice are included in resiliency planning has informed a framework for addressing the COVID-19 recovery. And recovering from COVID will be long and arduous. However, we can't lose sight of the necessity of equitable planning along the way. And by addressing the following issues, our cities will not only repair the damage wrought by COVID-19, but also work to repair the damage inflicted by past and present discriminatory planning practices. So first, and this is where it comes full circle, is we have to acknowledge the past and the present. Initially, when I began looking at the topic of resiliency, I was particularly struck by the stark contrast between cities that chose to address injustice in their communities through their planning documents versus cities that chose to ignore injustice and to ignore historical inequalities. Unfortunately, Boston is one of them from what I looked through in their resiliency documents, that they didn't really acknowledge the spatial marginalization and racist planning practices that have been committed in the city. However, in my research, I've looked at some really great examples, and I've pulled out some of them for you today that show how this acknowledgement can be done in an effective manner. And I present these examples kind of in order from like least to most effective as I see it. So first I have a page from the City of Oakland's resiliency document. And this was a lot of these documents are part of the 100 Resilient Cities project, which I think is now not ongoing. But this page is taken from the very beginning of Oakland's resiliency plan. And it addresses that new industries in the area have increased economic growth, but have also increased socioeconomic inequality and housing displacement. They point out that this growing disparity has harmed the quality of life for many of their residents. And then this page is from the city of Tulsa in Oklahoma. And they have a really harrowing story. Before 1921, the Greenwood neighborhood in Tulsa was a very prosperous Black community where residents owned large homes, they had cars, they were hotel owners, among other businesses. However, that year, a mob of angry white people destroyed the thriving community, and thousands of Black-owned homes and businesses were burned to the ground, and hundreds of people were killed, and 10,000 people were displaced from their homes. So this terrible incident, unfortunately, was largely ignored and forgotten, and kind of suppressed, essentially, over time. And a report on the incident wasn't even made until 2001, which was 80 years after it occurred. And so by addressing what has happened and the scar that it's left on this community through their resiliency planning documents, the city of Tulsa is bringing this to light and working towards essentially seeking justice for what's happened in the past and for the suppression of this incident. And I think this is an excellent example about how addressing past injustice can really pave the way forward, because this still lingers. And by having a lack of transparency with the community about something that's happened and the community knows is wrong, it's hard to establish a level of trust, but something like this can hopefully open the door for that trust to be restored. And so my last example is pretty point blank. It's from the city of Portland in Oregon. I didn't even need to go through their planning documents because they made this entire document talking about the history of racism and their planning practices in the city. And so I think this is an incredible example of how planning departments and cities can actively confront racist practices. And because the city of Portland created this document for public understanding and use, it shows that they're prioritizing the experiences of those that have been marginalized in their cities. And they're holding themselves accountable for hopefully fixing that, and making it clear that it's something that needs to be done. And so this leads to the next recommendation, which is to plan for the city's most vulnerable. In planning for a place's most vulnerable populations, we are actually, in fact, planning for everyone. And the curb cut effect really hits the nail on the head on this. It was coined by Angela Blackwell, and it makes the argument that striving to support the most vulnerable can actually help the entire population. The namesake refers to the sloping ramps along curbs that allow for wheelchair accessibility. And she describes that when the ramps were legally required, which multiplied their prominence, everyone benefited. Mothers pushing strollers, workers with heavy carts, travelers with luggage, people with groceries, skateboarders, whatever you can think of, like everyone started using those ramps instead of going along the curb. And so important to keep in mind that such initiatives like affordable housing, a strong education system, access to medical services, dignified job opportunities, reliable public transit, it helps everyone. And it really helps those that are most vulnerable and need it the most. So by promoting just inclusion and social innovation throughout society, cities can create conditions for everyone to participate, for everyone to prosper and to reach their potential. So lastly, prioritizing acts of collective healing. And to me, this means when considering how our cities can eventually recover from the exhaustive crisis of COVID, we must prioritize acts of collective healing that take community as the precedent rather than perhaps the individual or the big name businesses in the area. And this can look like many things. It can be a collaborative space, art installations, ongoing workshops, community activism, participatory planning practices. And this is really specific to what the community needs. And this quote is from a piece that I wrote with Julian for Springer Journal, in which, so we talked about the role of food as a conduit for healing in immigrant communities. And we suggest that to better support undocumented peoples, which are a highly vulnerable population in our cities, because of their lack of access to like social safety nets if they lose their work, and if they have difficulty finding housing, etc. But we suggest that cities can provide better opportunities for these peoples through such efforts as a community garden or other community-driven initiatives that enhance their experiences in the cities that they're living in. We frame this more for sanctuary cities, and Boston is one of those. So that rather than just passively saying they will protect undocumented peoples against federal criminal courts, it kind of moves beyond that into a more proactive manner to say, these are members of our community. They're highly vulnerable. They need more support. They need to feel that they're part of this community. And so moving forward from this work, it's evolved a lot. And the goal of all of these considerations has been to create a policy document that can be used as a guide by city officials on how to better support vulnerable populations, like undocumented peoples, who have been very much hurt by the COVID crisis, and will have a long way to come to get back on their feet afterwards. Yeah, so that's pretty much it. And let me know if you have questions.
Thank you, Alexandra. You should be able to unmute yourself and just ask questions if you have something. Mary?
So you know I always ask a question, so I get called on first now, Angela.
I saw your hand. Actually, I thought you were clapping, but
I was clapping.
Sorry.
But I also wanted to know from you, Alex, if you had kind of drawn any themes. So you chose a couple of cities. So I'm guessing you have a lot more cities that you've looked at and you've categorized them and put them into kind of different bins. You haven't done any interviews yet, right?
No, and it's difficult because the work has changed so much. It's more the resiliency literature review and looking through gray literature documents kind of informed where we are now. But I don't think that we're going to continue looking into resiliency issues in that way. I think it's more so just applying towards the future of like policy recommendations as part of the work.
Yeah, because one thing I'm wondering, it's one thing to write it down in a document, right, and put it on a website, but the extent to which Tulsa or Oakland or Portland are welcoming cities is a whole different question, right? They may be very unwelcoming, which is why they have the document. So it would be really interesting to know the extent to which the populations that live in these cities, because you noted that in Boston, it appears that we didn't do a very good job up in Boston. Yeah. And I'm guessing there are a lot more of these types of documents down south because they're, the racism was very present and embedded and in your face and required an action, right? Whereas up here it was a lot more under the table. I think you and I have talked about this before. Yeah. A lot more under the table, so they didn't need a document. But does that mean that Boston is more welcoming than the South? Probably not. Yeah. So anyways, that's what I was saying. And you can get at that with interviews or other indicators of how welcoming a city is beyond, because I was just thinking that a city that's quite racist might need a document like this. So the document presence in and of itself is indicative more of a not necessarily a good thing, but a bad thing. Any thoughts on that?
No, that's a fantastic point. And I think that qualitative element is so important. And it's like you were saying that I haven't seen a tool that really measures like, okay, they're saying this, but is it actually being practiced? And I think that would take a long time to really understand like how to evaluate that. It would definitely take interviews. I think it would be a wonderful thing to explore. And I think that it would better hold these planning departments accountable because I know planning has a reputation of the idealism, but like, let's see if it's actually happening. I do think that there is merit to creating a formalized document that outlines the issue because it's making it integral to like governance in that way. And so it's less able to be ignored because now that's a tool for saying, look, you say this is a priority, but it doesn't look like that on the ground, at least for like community organizations, to hopefully utilize that. Yep, a great point. Thanks, Mary.
Alexandra, you have some kudos in the chat, but from Lauren, does anyone else have any more questions for Alexandra? Greg.
Hi, Alex.
Oh, Sarah. Okay. And then Greg. Yep.
Great job. That was awesome. It's nice to see you. I'd love to know, just like following the thread of Mary's comment and what you all were just talking about, like what you envision as the community engagement or input aspect of this work, and like where you're hoping to see that move in the future.
Yeah, that's a great point. I mean, thinking about like Chelsea because of its proximity, like a lot of the issue is that like people are living in very close quarters because they can't afford housing. Once they lost their jobs, a lot of the people that live in that area like were not able to get public or the government benefits that perhaps everyone else may have gotten. And there was a lack of food security during COVID. And so it kind of like hits on all components of just like living a decent quality of life. And so I hope that the vulnerabilities that have been shown lead to prioritizing these very basic like necessities within cities. But unfortunately, I think a lot of it's going to be community driven like activism, like asking for this. But at least now they can point to what's been happening and say, like, you can see how vulnerable and precarious this is and how it can make something worse for the whole city with the spread of a pandemic. So I think there's a lot of layers to it and how to move forward. And I think it largely depends on the area.
Totally. Thanks.
Greg, do you want to ask your question?
Yeah, good job, Alex. I really liked your point about the curb cuts and how kind of planning for the most vulnerable really helps everyone. And I feel like a lot of planning departments don't think this way and tend to kind of try to go for the biggest, flashiest thing. Have you been thinking at all about how we can kind of restructure how we think about planning to make these types of things the priority?
Yeah, I think when it comes to advocating for a certain issue, like if you think about the curb cut issue, they may not have known that they had that tool in their belt when they made the requirement for the curb cuts, that it would be helpful for everyone. But now that she's done this research and we can put that in our tool belt, I think it's a good thing for like planners and other city officials when they're advocating for a cause to say this will help everyone for X, Y, Z reason. Because I think it's limiting to say that it's going to help this one specific population alone. I think like to some people that isn't always a good enough argument. So I think saying that it has these rippling benefits, I think could be really helpful. Thanks for asking.
We're just about at time, so if you have any other questions, Alexandra has shared her email here, and you got a round of applause from Dean Cook too. So thank you again, Alexandra, and we will be sharing this to the GSAS YouTube channel, so be sure to check that out, and if you haven't already, like us on Facebook, and we are sharing that as well. So thank you, Alexandra.
Thank you.